Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare home care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Welcome, Dr. Eric Lee, and welcome, South Florida listeners. We have a great, fantastic orthopedic surgeon who just moved into our neighborhood a short time ago. Dr. Lee, welcome. Thank you for coming to
Lou,
the show.
It's great to be here.
Listen,
thank you for having me.
My pleasure. Doc, tell the viewers especially, what's your medical specialty to start off with?
Yeah, so I'm an orthopedic surgeon. We specialize in conditions of the bones and the joints and the musculoskeletal system. We perform operations on the extremities. It's a very broad field. There are many different subspecialties. My subspecialty is in taking care of patients with hip and knee arthritis.
Well, that's amazing. I know, how many people would you say have arthritis? About 24 million people in this country have arthritis?
Yep, 24 million. It's a huge portion of the population. It's a huge healthcare burden. About 80% of those 24 million people have some sort of limitation in their motion. And so the treatment of arthritis is a big burden on the healthcare system. And it's one of the problems that I would like to focus and dedicate my career in taking care of.
Listen, look, Dr. Eric Lee, he looks so young, he looks so energetic. Guess what? He is that young, but he's a genius. What is some of your education? You went to Harvard, didn't you, Doc?
Yeah, I did my fellowship in adult reconstruction, so that's hip and knee replacements, at Harvard Medical School's Brigham and Women's Hospital.
Oh, my God.
And so I've focused exclusively on those two operations. Did about 450 hip and knee replacements during that year, and about 20% of those were complex revisions. So some of the more complicated situations you can find with hip and knee replacements that end up going wrong.
So if a patient comes into you, Doc, and he complains about his knee or his hip, do you automatically say, you need a new hip, or you need a new hip surgery, you need a new knee? What do you basically do before you operate in that patient? What do you do to stop that operation if you have to?
Yeah, actually, that's one of the most common things I hear in the clinic. I have a patient come in, and they say, oh, gosh, Doc, my knee's starting to hurt. Can we get an x-ray? We get an x-ray, and it shows really bad arthritis. And the patient says, Doc, does that mean I need a hip replacement? And they're asking me to tell them if they need a surgery. And one of the things that, the points that I like to drive home is that it's not about what I tell the patient. It's about, what the patient's experience with their chronic knee pain is. And so what I try to do is let the patient decide themselves, starting with the most conservative treatments out there and working our way up one step at a time.
So you don't recommend surgery right away. You're going to try these other cures for this. It could be arthritis. It could be something else. And if some of these patients react to that, you are not going to do the surgery, correct?
In most cases, it's very rare that I meet somebody for the first time and say, let's get you signed up for a surgery and do a hip or a knee replacement. In my mind, I like to get to know the patient, their specific problems, their specific background, where they're coming from, what sorts of things they've tried, what sorts of things they haven't tried. And really, for me, and the practice that I joined, we were very conservative. Surgery is always a last resort. I mean, I like to do surgery. That's my passion is performing operations. But in the clinic, when I meet people, that's a human being in front of me, and I would treat them the way I would treat myself, treat my family members, and that's really exhausting all conservative treatments possible before ever going into a surgery.
So listeners, how many doctors like this young man will say, listen, let's find out what the condition is. We're going to treat you for the condition. We're not going to treat you for surgery right away. So how many doctors say, listen, you need surgery? Well, why do I need surgery? You need surgery right away because you're bone on bone. They'll tell you anything. And if I was you and someone's going to tell me that, I'm going to go get a second opinion from Dr. Lee. Doc, would you take second opinions? Will the person come in and talk to you for a second opinion?
Yeah, absolutely. I'll pretty much see anybody. If you wanted a second opinion, or even if you see me and you want a second opinion from somebody else, that's, again, I put it all in the hands of the patient. I'm a big proponent of patient participation in their own care. The way I see it is I try to provide as much information as possible for the patients to make their own educated decisions, because everybody's a little bit different. It's very hard for me to say, make blanket statements based on an X-ray, say, this treatment's going to work for you, and this is what you need. I don't like to do that.
Because every time a person goes to surgery, doc, there's some kind of risk, right?
There are always risks. Anytime you have any type of surgery, big or small, there's always risks, and those are things you need to understand also going into the surgery. And whether it's abdominal surgery, heart surgery, lung surgery, or orthopedic surgery, your surgeon will go over all the risks and benefits with you, and so that you have an understanding of all those things. However small the risk, you should always be informed of those things.
Doc, where can our listeners reach you if they had to reach you to set up an appointment? And do you take insurance? What type of insurance do you take?
Yeah, our clinic is set up in Boynton Beach. We're on Boynton Beach Boulevard, just off Eau Claire Ranch Road. As far as insurances, we take most insurances, all the major insurances, most insurances for that matter. And personally, I don't even like to look at those sorts of things. If you show up on my schedule in my clinic, I'm seeing you.
So you're seeing no matter what, right? That's fantastic.
If it's up to me, I'll see you.
Okay. Doc, what's your phone number? How can they reach? What's your phone number at that location?
It's 561-733-5888.
Can we put that up? Let's repeat that. Repeat that phone number again, Doc.
561-733-5888.
And if you guys forget, anybody out there forgets that phone number, you can call All County Healthcare. We'll make sure you get and meet Dr. Lee. Doc, another question. What age group do you reach to see people? You see them younger, older? What age group really comes in to see you with this arthritis problem?
It can really be all over the place. I'd say the most common age group that I'm seeing in the degenerative joint disease, which is basically hip and knee arthritis, we're talking in the range of 50 years old to 70 plus years old. I still see people in their 80s for sure, and even people in their 80s are receiving operations, for hip and knee replacement. I've even seen people in their mid 90s, and on the flip side of things, it can get as young as in their 20s. I've treated in the past patients in their teens even. But by and large, I'd say most people fall within the 50 to 80-year-old range.
So that's good to know. So let me ask another question. When you treat a patient basically for this arthritis, what are some of the treatments you give the patient before surgery?
Yeah.
Some of
The first thing I always want to check is how conditioned is the joint. How conditioned are the muscles around the joint? So for knee arthritis, for example, the first recommendation that the American Academy of Orthopedic Surgeons puts out there is strengthening and conditioning of that knee joint. It's also the best available treatment quoted by the Arthritis Foundation. So really getting the muscles around that knee nice and strong, especially early on in the course of the disease process, is really key to one, pain relief, and number two, progression of the disease. Because what it does is it provides that knee joint with the stability that it needs, and avoids what I call a vicious cycle. So people fall into the cycle where they have knee pain, and instead of staying active and keeping that knee well conditioned, they'll tend towards more of a resting and an activity avoidance behavior. And so what that ends up doing is it causes muscle atrophy. That muscle wastes away. It gets deconditioned. Now you have less stabilization across that joint, and the pain actually worsens. And so that cycle continues.
Doc, we're going to take a break. I'm going to signal for a little break here. So we'll take a 5-second, a 10-second commercial. We'll come right back.
All right.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Welcome back. Dr. Lee, welcome back. Listen, again, you're located on the corner of Eau Claire and Boynton Beach Boulevard?
Yep, Eau Claire Ranch Road and Boynton Beach Boulevard.
And what's that address again?
It's 6056 Boynton Beach Boulevard, Suite 215.
And is there an MRI center in there too, in that building?
Yeah, we have an MRI center right in our clinic.
Great. So another question I got to ask you, Doc. Do I need a referral to see you? I got a Medicare Advantage plan. I'm not on Medicare, but do I need a referral to see you?
Yeah, so everybody has they have to check with their plan for me to give you a specific answer to that. For Medicare patients, typically a referral is required. Yeah.
For Medicare Advantage. But if I have straight Medicare, I can walk in and see a straight Medicare. Straight Medicare patient doesn't need a referral. They can just come in and see you. So if you have straight Medicare, folks, you can just walk in, set up an appointment with Dr. Lee, and he'll be happy to see you. If you have a Medicare Advantage plan, I believe you might have to get a referral from your primary. And, Doc, what's the phone number again over there?
It's 561-733-5600. 5888.
You know, and I was talking to Dr. Lee earlier today. We were discussing some things, and I told him I have two torn meniscuses. I didn't get them repaired yet, and I was telling him my problem, and I was like 37 pounds heavier. Now, does weight have anything to do with knee problems or hip problems?
Yeah, you hit it right on the head. Weight is a big, huge issue. So that's the number 2 recommendation from the American Academy of Orthopedic Surgeons. Every pound of body weight that you have is 4 pounds of force that knee sees.
Ooh.
So let's put it this way: if a patient loses just 12 pounds, that's almost 50 pounds less force that the knee experiences.
My God. And I'm so old.
What I like to tell.
Go ahead, Doc. I'm sorry.
I'm sorry. I was just going to say what I like to tell patients is, get in the pool and do some aquatherapy. Number 1, you can get your knee the muscles around your knee stronger. Number 2, if you get into water about waist high, that's taking about 50% of your weight off right there. And you walk around in that pool and you see how much less painful it is to take a step on that knee. That's what weight loss will do for you.
You know, it's true, because I lost last 2 months. I think I lost 35 pounds. I couldn't get off the chair previous to this. Now I get up off the chair and I'm running around playing golf. I can play golf again. It's easier. But, sometimes the pain still hurts. It's there. So I'm going to get over to see you because I want to see basically what you can treat my arthritis with. Because, I'm scared of going through surgery at my age. I don't want I don't want anybody cutting me up. But if I have to, I'll have to. So, Doc, let me ask you another question. Knowing that you've been you studied at Harvard and you get all the newest techniques, right? People might say, what's his experience? Well, the experience is he studied under the best facility there is at Harvard. He also studied at Brigham and Women's, you said?
Yep, that's right.
Brigham and Women's? It's one of the finest hospitals in Boston. Boston, Massachusetts has some pretty good institutions. Mass General, Harvard, all these institutions. Everybody I know that's down here from Boston says, oh, I'm going back to Boston. You don't have to now. You got Dr. Lee right here from Boston. He came down to see you. So how many good doctors are coming down to Florida now, like Dr. Lee, because they want to get out of that cold weather? I'm assuming you want to get out of that cold weather. You came to Florida, right?
Yeah, I came down here for the snow.
You came down here to get rid of that snow, right? But you came. Now, during this pandemic, are you still seeing patients?
Oh, yeah, absolutely. And it's interesting. It seems like when I was up in the Northeast, a lot of people wanted to do teleconference visits, just over Zoom. But down here, it really seems like people really want to come in and see their doctor. They want to bring in their family, which in these times it's a little bit difficult with the distancing and all that stuff. But I was always a proponent of bringing family members into the visit. It helps patients kind of remember, helps them have a kind of a coach at home to say, hey, this is what Dr. Lee told you. Do you remember that? So what I try to do now is if a patient ever wants it, I have them call in their spouse. They'll be on FaceTime. I also give people, packets of material to go home with for them to read and digest. And I give out my email to everybody, and I tell them to contact me with any questions or concerns, and I'm pretty responsive to that. Well, so it's a quick way to get a hold of me.
It's amazing. I can't picture, and I know you don't do it so often. A picture guy saying, "Oh, my hip hurts, my knee hurts. I want to do a Zoom meeting." Well, he's not going to be able to check you out with a Zoom meeting for your hip or your knee. It's not a cold. It's not a sinus condition. It's your knee and your hip. You can't walk. So you better get in to see him. And right now, he's willing to see you. So how many doctors are really willing to see anybody today? So Dr. Lee said, come on in and visit me, right? Come in and talk to me, and let's get to the bottom of what's happening to you, and we'll treat you for your disease. Am I correct, Dr. Lee?
Yeah, that's absolutely right. And I personally, I prefer seeing people in person and being able to actually examine them. And there's just a more of a personal component to it. I would also suggest two more things. in broad strokes for people with painful knees due to arthritis. And one is an over-the-counter medication. It's a class of drug, and they're called non-steroidal anti-inflammatory drugs. So these are called NSAIDs. Not everybody can take them. You have to check with your regular doctor, but they're very effective in alleviating joint pain.
Can you
And
take
so
that?
these,
I'm sorry. Can you take that if you have any kind of heart condition?
Yeah, it depends on what kind of heart condition.
Right.
If you have a serious heart condition where you're on some blood thinners, some potent blood thinners, you have to be careful with that because these NSAIDs also do thin your blood even further. So these are things like Motrin, Advil, ibuprofen, Aleve, simple over-the-counter medications. Number one, if you have a heart condition where you're already on blood thinners, you have to be careful. If you have stomach ulcers or you get upset stomachs when you take these sorts of medications, you've got to be careful. And then finally, if you have any kidney problems or kidney disease, you have to stay away from them because they can be very hard on your kidneys to try to clear. But other than that, if you don't have those things, you can take these pain medications, and a lot of times they're very effective in prolonging any sort of more invasive procedure being done for something like knee arthritis.
Well, I can tell you, after talking with Dr. Lee right now, you can see his mannerisms. You can see basically his bedside manner. He's going to take as much time as you possibly need. I believe he will. I know he will, to discuss your problem, solve your problem. He's not a doctor who's going to say every 15 minutes he has to see somebody, or 10 minutes. He's going to basically give you the time that's necessary to solve your problem. So, listen, this is a young man who came out of the best school out of Massachusetts, the best hospitals. He basically is willing to see your patients right now, no matter what kind of insurance. Give him a call now. Dr. Lee, that number again is?
561-733-5888.
That's 561-733-5888. 5888. So please, if you have a problem with your knee, your hip, any arthritic problems, go in to see Dr. Eric Lee. He's a fantastic young man. And he, people say, well, he's probably too young. Well, guess what? I'd rather go to a young guy that's got all the up-to-date situation knowledge than a guy that's been in practice for 40 years and doesn't know anything because he's still back 40 years ago. So Dr. Lee now basically has all the knowledge of current knowledge of what's happening in the industry, correct? The new knees, what type of knees are coming in?
Yeah, that's right. So I trained on robotic technology. I used personalized implants and trained to do the latest personalized custom instrumentation as well as implant devices as well. So yeah, up to date on all the cutting edge technology, that's for sure. And we didn't really get a whole lot of time to talk about that, but I wanted to talk more about avoiding those situations.
We're going to have you on again. They're telling me it's time to go. It's been a pleasure to have you on. He's a fantastic young man. You got his phone number. If you don't have his phone number, please call All County Healthcare. We'll get you in touch with Dr. Lee. Dr. Lee, again, thanks for coming on. We'll chat a little later on about my knees, okay?
Okay, will do.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life. The opinions expressed on the preceding sponsored program were